How to start your home care agency in Texas. Are you thinking about starting a non-medical home care business in Texas? You're in the right place. In this video, I'll walk you through everything you need to launch your agency in Texas. Let's get started. What is a non-medical home care business? A non-medical home care business is a service-based business that provides personal assistance and support to individuals, usually seniors or people with disabilities, who need help with activities of daily living. In Texas, this is officially called P.A.S. Personal Assistance Services Agency. It's a great way to serve your community while building a sustainable business. Services typically offered include companionship, personal care, meal preparation, light housekeeping, medication reminders, transportation, errand assistance, respite services, and Alzheimer's dementia care. Why start a home care business in Texas? 1. Massive demand for senior care. Texas has one of the fastest growing senior populations in the country, and many of them prefer to age at home. That creates a huge and growing need for non-medical personal care services. 2. Strong demand for in-home, non-medical services. From busy families to veterans to people living with disabilities, more Texans are choosing in-home care over nursing facilities. That shift is creating long-term demand for personal assistance services, and that's exactly where your agency fits in. 3. Clearly defined licensing structure. Texas has a clear, structured licensing path through the Health and Human Services Commission. 4. Private pay, Medicaid, and VA reimbursement options. Once licensed, you can serve private pay clients, but you also have the option to become a Medicaid waiver or VA-approved provider. That means multiple income streams and long-term business stability. 5. Huge diversity in care needs. Texas is diverse, not just culturally, but geographically and economically. From major cities like Houston and Dallas to underserved rural areas, there's room for agencies of all sizes and specialties to thrive. 6. Supportive small business climate. Texas is known for its pro-business environment, no state income tax, streamlined LLC formation, wide access to workforce training grants and small business support. That means fewer startup barriers and more room to grow. 7. You'll make a real difference. Home care isn't just profitable, it's purposeful. You're helping people stay safe, independent, and supported in the place they love most, their home. How do I go about obtaining a business entity? Step 1. Choose your business name. You'll want to choose a business name that's unique and not already in use. To do this, visit the Texas Comptroller of Public Accounts website and search their business name database. This helps avoid name conflicts and future delays. Step 2. Reserve your business name. If you're not quite ready to file but want to lock in that perfect name, you can file a name reservation, Form 501, with the Texas Secretary of State. The cost is $40 to hold your business name for 120 days. Step 3. Obtain an assumed name certificate. If your business will operate under a name different from its legal entity name, you'll also need to file an assumed name certificate, commonly known as a DBA. Step 4. File your certificate of formation. To officially form your business, you'll file Form 205, Certificate of Formation, with the Texas Secretary of State. The current fee is $300, an additional $25 for expedited service. Securing your employer's identification number, EIN. An EIN is a unique 9-digit number issued by the IRS to identify your business for tax purposes. This is available at no cost if filed through the IRS. Principal business must be located in the United States or U.S. territories. Licensing application requirements. Before starting the application process for licensing, you will need the following: A letter of good standing, also called Certificate of Account Status. This provides status of an entity's right to transact business in Texas. Log into the Texas Comptroller's office. B. Entity documents for business organization. These would be your assumed name certificate and your business entity. C. Copy of taxpayer ID document. This would be your employer identification number. D. Organizational chart. This shows your operational structure, denoting lines of authority from administrator down to patient care level, to ensure there are clear lines of authority, responsibility, and accountability in the administration and delivery of agency services in the community. E. Current resume of the administrator and alternate administrator. Prepare a credible and professional resume for the above positions. F. Job descriptions for the agency administrator and alternate administrator. These are also available in your P.A.S. policy manual folder if already purchased. G. Copy of computer-based training for an initial administrator and alternate administrator. Complete the pre-survey computer-based training CBT. Remember to print and sign the certificates at the end of each session. H. Plan for the orderly transfer of care. The plan must be implemented in the event of a transfer or dissolution to assure continuity of client care. I. Plan for continuing education for management personnel. A written plan to provide annual continuing education for management personnel is required as follows. 1. Initial 8 clock hours. The initial 8 clock hours must be completed by the agency's administrator and alternate administrator during the 12 months immediately preceding the date of designation to the position. It covers the following core topics: licensing standards and governance, state and federal laws, abuse, neglect and client rights, emergency preparedness, and quality assurance. 2. Subsequent 16 hours. The subsequent 16 clock hours must be completed by the agency's administrator and alternate administrator before the first anniversary. Training must address the following areas: fraud and abuse detection and prevention, legal issues regarding advanced directives, client rights and confidentiality, agency responsibilities and compliance, complaint investigation and resolution, emergency preparedness and planning, abuse, neglect and exploitation prevention, and infection control practices. 3. Each subsequent 12-month after designation. After completing the 24 hours of initial educational training, prior to or during the first 12 months after designation as a first-time administrator and alternate administrator, the administrator and alternate administrator will complete the 12 clock hours of continuing education. The 12 clock hours will include at least 2 of the following topics and may include other topics related to the duties of an administrator. 1. Any one of the educational training subjects listed under subsequent 16 hours. 2. Development and interpretation of agency policies. 3. Basic principles of management in a licensed health-related setting. 4. Ethics. 5. Quality improvement. 6. Risk assessment and management. 7. Financial management. 8. Skills for working with clients, families, and other professional service providers. 9. Community resources. Or 10. Marketing. You now have all the required documents needed to apply for your HCSSA license through the Texas Health and Human Services Commission website, TULIP. What is TULIP? TULIP is an electronic system for submitting all licensure applications, including those for initial licenses, renewals, and changes of ownership. You can use it for submitting electronic payments, submitting resident death reports, accessing the status of licensure applications, and sending and receiving notifications and updates related to the licensure process. Completing HCSSA application, Form 2021 on TULIP. First, you will create a TULIP member login account. The response to your email from TULIP may be slightly delayed. Be patient. Do not create multiple member accounts, as this will cause further delay in response. Remember to designate the right email when creating an account, as this will be the email HHSC will contact you through, and you don't want to miss that important email. Once you have your login information, follow the steps to complete HCSSA application Form 2021. When done, you will be prompted to submit your licensing fee. Fee can be submitted electronically on TULIP or by physical check or money order. Please note that the processing time will be longer if you choose mailing option. License processing duration can take anywhere between 30 to 45 days. Open a business account. You will need articles of incorporation, the entity under which the business is registered, employer's identification number, fictitious business name statement, business address, business license. State income tax. There's currently no state tax withheld from employees in the state of Texas. Workers' compensation. Unlike most states, Texas does not currently mandate that employers carry workers' compensation insurance. It is, however, still a great insurance to have to protect you and your business. Unemployment compensation, any employer paying at least $1,500 in wages in a calendar quarter or has at least one employee during 20 weeks in a calendar is required to pay for unemployment insurance. Medicaid Waiver Program. If you plan to serve Medicaid clients, you'll need to enroll as an official provider online through the Provider Enrollment and Management System, PEMS, run by the Texas Medicaid and Healthcare Partnership, TMHP. After approval, you'll be assigned a Texas Medicaid Provider Identifier, TPI, and you'll gain access to Medicaid billing systems for claims processing. IRS tax forms to remember, Form 941, Form 940. Deadlines to file above forms will be indicated in the EIN. Tax fines. Do not forget to take care of the following. Each year you must file a franchise tax and public information report, though if your revenue is under the threshold, it's a no tax due filing. Just don't miss the May 15 deadline. Additionally, to avoid penalties, review the procedures and requirements as it pertains to display of license, initiation of care, license renewal, change of ownership, alternate delivery site, agency relocation, change in the agency's contact information and operating hours, agency name change, change in the agency's organizational management personnel, adding or deleting a category of service to the license, expanding or reducing the agency's service area, agency closure. Detailed guidelines can be found by searching Texas Administrative Code, Title 40, Chapter 97. Administrative needs. The following are essential to have in place to effectively run your business and before your initial survey: Policy Procedures Manual, Employee Handbook, Admission Packet, Complaint Log, QAPI Folder, Infection Control Log, Emergency Preparedness Folder, and Staff In-Service Training Log. Get business insurance. Protect your business and your clients by securing the following insurance policies: general liability, professional liability, workers' compensation, not mandated in Texas, commercial auto insurance if transporting clients. Hire and train caregivers. Next, hire compassionate and reliable caregivers. Texas doesn't require formal certification for P.A.S. workers, but background checks are a must. Prepare for survey. The following is a list of things that surveyors often ask for on an initial survey: scheduled home visits for the week of survey, active client roster, discharge roster for the last 12 months, active employee roster, active employee files, admission packet, complaint log, copy of license and CLIA waiver, staff in-service training records, quality assurance performance improvement, QAPI, infection control documentation, emergency preparedness plan, agency annual evaluation. Market your business. Once you're licensed and staffed, it's time to market your services. Here are a few tips. Build a website and Google business profile. Print brochures and business cards. Network with hospitals, senior centers, rehab facilities. Join local chambers and health associations. Ask happy clients for reviews and referrals. Resources. Below you'll find a full list of helpful resources including links to register your business, apply for your EIN, apply for your license, explore Medicaid waiver enrollment, and more. Starting a home care business in Texas takes planning and patience, but with the right foundation, you can build a business that truly changes lives. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you. And feel free to share this with anyone who might find it useful. See you in the next video.